Welcome so much, Daktari.
Thank you so much.
Yes.
Yes.
Mm-hmm.
Yeah.
My viewers, those who are new would like to know who is Daktari. You know, I'm saying Daktari, but they do not know you
All right.
as an individual.
Thank you so much.
Yeah.
Viewers, my name is Callistus Wekesa. I'm the Executive Director of AfriCare Foundation. AfriCare Foundation is a non-governmental organization that deals with mental health awareness and substance abuse prevention among the youths of 13 years to 40 years of age. We serve 7 counties, all the way from Turkana, Kalobeyei Camp, West Pokot, Trans Nzoia County, Bungoma County, Busia County, Kakamega, and of late we have moved to Vihiga County.
Okay.
Yes.
Thank you so much for that introduction. Having said that, today, this month has been a very interesting and very important month.
Yep.
It has been a suicide prevention and awareness month.
Yeah.
And for our viewers back there at home who are wondering, maybe some do not understand the concept of suicide. What is suicide? How can we define it?
Thank you so much,
Yes.
Shiloh. So, most people talk about suicide.
Mm-hmm.
You will see here news talking about suicide.
Yes.
So maybe just to make it simple for our viewers,
Mm-hmm.
suicide is an intentional end of one's life.
Mm-hmm.
So a person ends his or her life intentionally.
Okay.
And some people say it is a permanent solution to a temporary challenge or a problem.
Okay. Mm-hmm.
So you permanently end your life, you kill yourself,
Mm-hmm.
and you do it intentionally, knowingly. Of course, you have had some thoughts about it,
Mm-hmm.
so eventually you decide to end it.
Yeah.
So it is just like that, as simple as that.
Okay.
Ending one's life intentionally.
Mm-hmm.
Yep.
Okay, that is
Correct.
quite interesting, and thank you for that simple introduction. Now, when we're talking about Suicide Awareness Month,
Yes.
what is the significance of this month, this Suicide Awareness Prevention Month, in raising public awareness about it?
Thank you so much,
Mhm.
Sheila.
Yes.
Actually, this month of September is a very crucial month.
Mm-hmm.
It is the month that we normally create awareness and, of course, awareness of suicide,
Mm-hmm.
and also giving the prevention tips
Yes.
to our clients and actually globally.
Mm-hmm.
Normally, it is celebrated on between the 8th to 10th, but most countries celebrate on 10th
Okay.
as a day of World Suicide Prevention Day awareness.
Yeah.
So the major reason why we do this, or why we carry out this event, is that one is that we want people to know
Mhm.
the really warning signs of suicide.
Okay.
We also want people to understand
Mhm.
how they can be able to avoid or overcome suicide,
Yeah.
and also want to let people know how somebody can be managed when he or she has suicide thoughts.
Mm-hmm.
Remember that most people always, majority of people think of dying,
Mm-hmm.
but now they lack the tips on how to get out of those kind of ideas or thinking.
Yeah.
So we create this awareness to just help them understand when they have such kind of thoughts, it's
Mhm.
about suicide.
Okay.
And also when they are in that scenario, that cocoon, in that event, the particular time when they have such situation,
Mm-hmm.
we always tell them where they can seek help. And of course, we even tell them how they can acquire that help.
Okay.
So the major reason why we do this is that we just want to create that awareness to people to know what is suicide.
Mm-hmm.
If they have such kind of symptoms or signs,
Mm-hmm.
they can be able to visit our facilities for treatment.
Mm-hmm.
The other thing why we are holding this thing is that suicide cases have come up.
Okay. Yes.
It's estimated that 700,000 people die every year.
700,000.
Correct. 700,000 people. And the latest studies has it that
Mhm.
720 people
Mm-hmm.
die every year
Okay.
globally.
Okay.
And remember, these statistics, I can say some go without being reported.
Mm-hmm.
So for those who are reported are around 720. So you can imagine those that are not reported. So probably the number is higher than 720,000.
Yes.
Correct.
Okay. Thank you so much for that. And it is quite unfortunate
Yeah.
that there's that large number of individuals who are involved in this. And when we are talking now about suicide, I believed you mentioned maybe later on or previously in our discussion that there are different stages of suicide. Can you just give us maybe a brief introduction to how are these stages different? And what are these types of stages, unfortunately?
Oh, thank you so much.
Mhm.
We have 3 stages of suicide.
Okay. 3.
Yes,
Mm-hmm.
just like stages of death. So stages of suicide are 3.
Okay.
Number 1 is ideation stage,
Mm-hmm.
threatened stage, and attempting stage. Now, when we talk about ideation stage,
Mm-hmm.
this is the stage whereby a person thinks of having dying, or of course taking his or her own life intentionally. So they have those ideas. That's why we call it ideation or idea stage. They think of killing themselves because of challenges they face or burdens within their life. So that is stage 1,
Mm-hmm.
ideation. Stage 2
Ideation.
is threatened.
Okay.
But before I move to stage 2, that stage 1,
Mm-hmm.
as much as they have these thoughts about killing themselves,
Yes.
but within them there is that force telling them, but life is better than dying.
Mm-hmm.
So there is some push, at the same time
There's some pull.
there is some pull.
Mm-hmm.
So they end up having those thoughts, but they don't commit suicide.
Okay.
So in stage 2, which is now a threatened stage, at this point, now the ideas of dying are stronger, much stronger than the ideas of living.
Mm-hmm.
So they feel like now dying is the best option compared to living.
Okay.
And so they end up having repeated thoughts of dying all the time
Mm-hmm.
than thoughts of living. Then stage 3, which is attempting, is the final stage. Now this person eventually takes his or her own life. So intentionally they kill themselves.
Oh my. Mm-hmm.
Very unfortunate, because these stages actually happen. And that's why this month of September
Mm-hmm.
is the month we are creating awareness, so that these people who are at ideation stage
Mm-hmm.
should not proceed to threatened stage. Because if you will be able to understand that the ideas or this thinking kind of you have will lead you to grave, we better now give you the solution,
Mm-hmm.
offer you the options why you ought to live than to die. Because death, as I said,
Mm-hmm. Yes.
is a permanent solution to a temporary challenge. Why do you want to kill yourself when the challenge you have is temporal?
Mm-hmm.
It's a question.
Yeah.
We need to consider facing the challenges to overcome them
Mm-hmm.
than taking away our life forever.
Mm-hmm.
Because taking away your life does not solve the challenge you have. Instead, it creates more problems to those who are alive, those who
Mhm.
are still living.
For those who you left behind.
Correct? And at the end of the day,
Mm-hmm.
you burden them more than when you are alive.
Yes, because of the guilt. They will ask themselves like, I was there. I talked to him
Yeah.
or her. She
Yeah.
was okay.
Correct?
What happened?
And that's
Why
why
did I not go?
correct, and that's why you see, Shiloh,
Mhm.
many people who commit suicide,
Yes.
they end up first of all thinking of it.
Mm-hmm.
Number 2, they end up having their own meetings. That is private meeting, talking
Mhm.
to yourself,
Okay.
making a decision. You call yourself a cabinet meeting, and you are the chair in that meeting. At the same time, you are a member of that cabinet committee.
Mm-hmm.
Then you end up making your own resolutions
Mm.
without seeking help,
Mm-hmm.
without seeking advice from the people who are close to you.
Yes.
Then eventually you end up having a resolution of killing yourself. This resolution of killing yourself, you have not consulted any other person.
Mm-hmm.
Remember, you are the chair, remember, you are the secretary, and you're also a member of that committee.
Mm-hmm.
Eventually, you decide to kill yourself. And then when you kill yourself, you do not only affect yourself, but you also affect the community, the people who support you, people who depend on you, and
Mhm.
the people who are around you. At times we make quick decisions
Yeah.
that eventually leave a big gap and hurt many people behind. As you go to the grave, you have created more problems to those who are living. So this month importantly is there for us to create this awareness, so that a person like you who might be having these challenges, these kind of thoughts, should not proceed to the stage 2 and 3. Should just remain in stage 1 and come out of that stage 1.
Absolutely.
All right.
And thank you so much for that very important understanding of the different stages that
Correct.
occur.
Yes.
And it's quite unfortunate that we tend to call ourselves for meetings and we do
Yeah.
not ask for advice
Yeah.
or seek help from others,
Yeah.
which is quite unfortunate. Now, when we are discussing now about suicide, you mentioned about signs, warning signs. Now, what are, in terms of from your medical perspective, what
Correct.
are some of the most common warning signs or risk factors
Mhm.
of suicide thoughts or behavior?
Thank you so much.
Mm-hmm.
It's a good question.
Okay.
It's a very important one.
Yes.
So we have warning signs,
Mhm.
signs and symptoms
Yes.
of suicide.
Mm-hmm.
Now, one of the warning signs is that, like stage 1, having thoughts of killing yourself.
Mm-hmm.
You see a person will tell you, I feel like I better die than live.
Okay.
A person will tell you, I feel like it's good not to be alive. It's better not to be alive.
Mm-hmm.
It's better to kill myself and go and leave this world. I understand that there are many challenges everybody faces.
Mm-hmm.
In fact, people should understand that in this life, everyone is facing challenges, regardless of the stage, regardless of the age,
Mm-hmm.
regardless of the socioeconomic status in the society. But what makes a difference is how you face them
Mm-hmm.
and solve them. That's what makes a difference. So one of the signs and symptoms, or a warning sign,
Yeah.
or a risk factor for a person who is candidate for suicide,
Mhm.
is thinking of getting away your life.
Mm-hmm.
That's a very dangerous statement. If a person tells you, I better die than live,
Mm-hmm.
don't take it lightly, because it is a sign of suicide.
Yeah.
And so the most important thing to do for such a person is to actually counsel them to seek professional advice.
Okay.
Number 2 is about, you will see these people, by the way, giving others their belongings.
Mhm.
For example, you will see a person taking a TV, he will give you chairs, he'll give you bed, he'll even hand over their cars and tell you bye-bye.
Okay.
It's a worrying trend,
And
because
they're not going anywhere.
and they are not going anywhere, they're just giving you, genuinely they give you,
Mm-hmm.
but you don't see the reason.
Mm-hmm.
They can't tell you they are sick,
Mhm.
neither can they sometimes tell you they are feeling unwell,
Mm-hmm.
but just give you their belongings without even you requesting them,
Okay.
and they tell you bye-bye.
Mm-hmm.
So you wonder, what are they saying? Are they playing in drama, or
Mm-hmm.
is it maybe something's not right?
Okay.
But eventually, if you don't take it seriously by questioning them,
Mm-hmm.
they'll do it after they have given you. The following day, you'll find them hanging. So they hang up themselves.
Mm-hmm.
Some of them will take poison.
Yeah.
Some of them can even jump in the river. They can even jump in the ocean.
Mm-hmm.
Even some of them sleep across the road.
Road.
They are run over by
On the
vehicles.
rooftop.
So many things happen.
Mm-hmm.
So when you see a person is giving you his or her belongings
Yeah.
without explaining why, and you have not asked for it,
Mm-hmm.
kindly don't take it.
Okay.
Inquire more. Why are they doing that?
Mm-hmm.
You have not requested. And why are they giving you even if you have requested, and yet they also need them?
Mm-hmm.
So that is another sign that this person is on the journey of suicide
Okay.
or self injurious harm that
Mhm.
leads to death. The other thing that can be another warning sign
Mm-hmm.
to this person who is about to commit suicide is when this person becomes emotionally unstable.
Emotionally unstable.
Correct.
Okay.
You will see that this person who always talks,
Mm-hmm.
they just reach at a point and they go cool, quiet. They don't talk much. And it's a person they talk a lot.
Mm-hmm.
It's a person who shares a lot, who is
Okay.
always flexible and
Mhm.
free to talk to people.
Mm-hmm.
But today you discover this person cannot share with you much. He's just keeping quiet.
Mm-hmm.
He can't explain why he's quiet. That's another warning sign.
Mm-hmm.
So such people, you need to take them seriously.
Okay.
You have to ask, why are you quiet today?
Mm-hmm.
There are people who are smiling like myself, always. But that day they are not smiling.
Uh-huh.
They're just appearing gloomy with stony face. They can't talk much.
Mm-hmm.
That's another warning sign that
Okay.
there is something that is not right with this person. So it's
Right.
always important to inquire more.
Mhm.
Why are you not in your usual mood? And you
Mhm.
can sometimes find even people who are ever jovial, and that day they are not jovial.
Mhm.
They appear to be more serious than seriousness.
Serious and more serious than seriousness. Uh-huh.
Yeah, extremely serious, that is.
Mhm.
And then you can't see the reason why they are very serious.
Mhm.
They appear to be more of unhappy with that stony face
Mhm.
than the jovial
Mhm.
moods you always know.
Okay.
So that one is also another sign that this person, something is not right, all
Mhm.
is not well. It is always important to inquire more why.
Mhm.
The other last maybe warning sign
Mhm.
is when you discover that these people are buying this poison, like for example pesticides,
Mhm.
but they don't explain the reason why they're buying it.
They do not
You
have a
can't see
farm
the,
there.
yeah, and you
Uh-huh.
don't see where they are supposed to use it.
Mhm.
It's also a worrying trend
Mhm.
because this might be a drug that they will take
Mhm.
to take away their lives.
Okay.
So when you see a person is buying a pesticide or a poison
Mhm.
instead of buying food, definitely it's a warning sign
Yes.
that this could be this drug will be used to kill this person.
Mhm.
The other last thing is another last thing that is also very important
Mhm.
is when you realize this person is carrying him or herself carelessly.
Okay.
For example, you walk with this person, but along the road, the guy is just walking at the middle of the road, and he can't
Oh.
even fear the vehicles coming.
Mhm.
So it is unusual for you because definitely you fear that there is danger ahead.
Yeah.
But for them, they don't fear.
Mhm.
They don't see any danger. They are comfortable walking are just in the middle of the road.
Mhm.
That's also another sign that this person might commit suicide.
So there's a need for him or her to get help
Correct. That is
immediately.
correct. And the other thing that I've just remembered again
Mhm.
is when you see this person, let me just give a practical example.
Mhm. It's
For
okay.
for example, a person is a teacher in that manner, or a police officer, because many cases are also happening with police.
Yeah.
And then this person, definitely they need to report to work.
Mhm.
And there is always a rule, for example, in a police force,
Mhm.
whereby you're not allowed to go home with a firearm
Yeah.
unless you're on official duty.
Mhm.
And then all of a sudden, this person, instead of surrendering a firearm to the armory
Mhm.
where they take from,
Yeah.
they go with this firearm at home without a permission
Mhm.
or a license,
And they're
allowing
not
them
on
to go home.
duty.
And they're not on duty.
Mhm.
It's another worrying trend because most of the cases you discover that when they go home with these firearms, they end up shooting themselves.
And unfortunately, sometimes the family members who are present. there.
Yes. Yeah,
Mhm.
correct. We have had cases whereby a spouse or a husband shoot a wife and shoot himself and even kids.
Yeah.
You realize the wife kills herself and kills the husband.
Mhm.
These are cases that are happening across our country.
Mhm.
So it's also a worrying sign.
Yeah.
You see people walking with firearms, with these weapons that are dangerous,
Mhm.
deadly. It is also a worrying sign.
Yeah.
Unless otherwise, probably they are using on official duty.
Mhm.
But if it's not an official duty, then it's not allowed.
Mhm.
It's a sign that this person might kill herself or
Mhm.
himself.
Okay.
Yeah.
Wow, that is quite a handful, but very much interesting. And I hope, my viewers, you've been able to really, really get an understanding of why we are doing this. That is Suicide Awareness and Prevention Month. That we should be very cautious of these signs. We should watch out for each other because sometimes someone else can notice that there's something wrong with you, and from that is when you will be able to seek help. So ensure that you're always vigilant to that loved one and to that.
Sure. As I said earlier, we are losing 700,000 people every year
Yes.
globally.
Mhm.
So when we narrow down to our country, Kenya,
Yes.
the youths are the most affected
The youth.
group. Yes, they're the most affected
The
group
Gen
with
Zs
suicides.
and millennials.
Correct.
Ah,
And
really?
this one we are
Unfortunate.
talking about the age of 15 to 29.
So even Gen Alpha.
Yeah.
Okay, yes. Uh-huh.
Yeah. So 15 to 29 years of age are the most affected group
Mhm.
with these cases of suicide.
Okay.
Actually, it is the leading cause of death in that age group
Mhm.
of 15 years to 29 years of age in
Okay.
Kenya. And it is one of the reasons why we need to have this awareness month.
Okay.
And to me, I think we need to have more than 1 month in a year,
Mm-hmm.
because these youths sometimes they lack these services,
Mm-hmm.
this awareness. Majority of them are not aware.
Mm-hmm.
They have not known well the signs and symptoms of suicide.
Yeah.
And another thing is that these youths,
Mm-hmm.
you know very well that this age bracket of 15 to 29, they're in school.
Mm-hmm.
Of course, at 29, some of them are completing campus, colleges, those tertiary institutions.
Yeah.
But they have not had opportunity, maybe, to get this information fully.
Mm-hmm.
And so, majority take up this life because they lack knowledge. The other reason why they do that is because they think that it's the shortest way to solve their challenges.
Mm-hmm.
Yet, it is the worst and longest way, creating more problems
Mm-hmm.
when they do that, when they take that route. So, yeah, statistics has it from WHO, the one I've given you, and
Mhm.
CDC,
Yeah.
that was done in 2023 and
Mhm.
2022.
Okay.
Shows that 700 to 720. And remember this statistic, 700 to 720,000 people dying globally
Mm-hmm.
is not really, might not be very actual. Why?
Mhm.
Because majority of these suicide cases go unreported.
Yeah.
Yes. So if we narrow down and be able to find out these unreported cases, you
Mhm.
realize that it's more than 700,000
Absolutely.
in a year.
Mm-hmm.
So, yeah. So there's some factors that contribute to this, and
Mm-hmm.
the most common one, especially in our setup in Kenya,
Yes.
is the socioeconomic status, socioeconomic factors.
Mm-hmm.
You realize that most people here in Kenya, especially these youths who have gone to school, they don't have jobs.
Yeah.
Some of them have applied jobs in various companies,
Mhm.
places, but they have not succeeded to get this opportunity to
Mhm.
get employment. And remember, they have certificates, they have their documents with them.
Mm.
They were also ambitious while they were in school.
Mm-hmm.
They knew that once they're done with campus, they will get jobs outside there. But they go outside there, start again walking around, hustling, but
Mhm.
eventually they don't get employment. So they feel like they're wasted in a way.
Mm-hmm.
And so they decide to take away their lives
Okay.
intentionally. Underline the word intentionally.
Intentionally.
Yeah.
Oh my. That is indeed a handful, and it's quite unfortunate that the young generations, the Gen Zs, the Gen Alphas, and Millennials are the most affected when it comes to suicide rates being high. And now, I'd like for us to move forward and now to look at in terms of prevention.
Yes.
You know, we have talked about the signs. What about now preventions? What prevention measures can maybe communities and institutions out there do or take to ensure that they reduce suicide rates?
Thank you so much.
Mhm.
And I'll break into two. That is
Okay.
community and, of course, the institutions.
Yeah.
Now, let's begin with the community.
Mm-hmm.
You know, community is the primary, I can say, primary institution
Mm-hmm.
to the victims of suicide.
Yes.
Now, one of the best things they can do is to reduce stigma,
Mm-hmm.
avoid stigmatizing these people.
Okay.
If a person has attempted suicide, for example,
Yeah.
they should not be isolated from others.
Mm.
They should not be viewed as bad people.
Mm-hmm.
They should be embraced
Okay.
and encourage them never to repeat.
Mm-hmm.
And they should also accept them and help them to, actually, they should take them to the professionals.
Mm-hmm.
Those are healthcare professionals
Yes.
for advice,
Mm-hmm.
for counseling, and for psychotherapy.
Mm-hmm.
The other thing the community should do is they should always be willing to share challenges together
Okay.
and be able to help each other where
Mhm.
necessary.
Mm-hmm.
For example, if a person is having a challenge with school fees,
Mm-hmm.
the communities should come together and even contribute the little they have to assist this person come out of this challenge.
Yeah.
The other thing that is always common is if somebody lacks food and you have something,
Mm-hmm.
always come out, be a generous person, share with whatever little you have
Mm-hmm.
with this person who is facing that challenge.
Yes.
Let me tell you why. Some of these suicide cases can
Mhm.
be prevented if the community can be willing to share challenges and help solve the solvable problems.
Mm-hmm.
I told you that these suicide cases happen
Mm-hmm.
due to temporary challenges.
Yeah.
Meaning that the challenge you go through is not permanent.
Mhm.
At one particular time it will come, you will overcome. But now the challenge you're having again for yourself is that you view this challenge as a permanent one. and yet it is a temporal one.
Mm-hmm.
So if the community could be able to listen to each other and actually seek solutions,
Mm-hmm.
I can assure you we will reduce these cases of suicide. Now let's move to the institution one.
Mm-hmm.
For example, the hospitals.
Yeah.
A hospital, one of the things that it can do to prevent suicide cases
Mm-hmm.
is by creating awareness. Have a person within that facility
Mm-hmm.
to give healthy talk to your clients. Don't wait for them to come when they have suicide problems.
Mm-hmm.
Let everybody who has come to your facility get this suicide message,
Mm-hmm.
so that when they go back home, they can spread the gospel. They
Mm-hmm.
can spread the message to those who may not be aware of signs or warning signs or risk factors
Mm-hmm.
of suicide.
Yeah.
Number two is that these facilities
Mm-hmm.
should be willing to offer services at all corners. For
Mhm.
example, a facility that has a psychologist or a psychiatrist,
Mm-hmm.
they should be willing and readily available to offer services to the victims of suicide.
Yeah.
Remember, most of the facilities have no psychologists.
Mm-hmm.
Some of them don't have psychiatrists.
Yes.
But we have a facility around us here,
Mm-hmm.
so-called Tuane Highway Mission Hospital. It has a psychologist and at the same time has a psychiatrist.
Mm-hmm.
So those cases, for those who are facing them, we welcome them to our facilities
Mm-hmm.
to come and seek these services that we give at a friendly cost.
Mm-hmm.
All right?
Okay.
And the good thing today is that the healthcare insurance, the so-called SHARE,
Mm-hmm.
actually has that package for mental health.
Oh.
And it can assist people to come out of this.
Mm-hmm.
Only if you people will speak. A person, you who is facing this challenge,
Mm-hmm.
never keep quiet to yourself. You are not facing it alone. There are other people outside there who are facing the same challenge.
Yeah.
Kindly come out.
Mm-hmm.
Let us hear you. Shout. Let us hear you. Let us listen to you,
Mm-hmm.
so that we can be able to assist you where we can. So that at the end of the day, the challenge you feel like it is so big can end up being the smallest challenge. And eventually, we will find a solution so that we prevent these deaths that are happening globally.
Mm-hmm.
The other last thing that institutions can do is that they should also have posters
Mhm.
within their area where there is what we call a waiting bay,
Mm-hmm.
so that people can also read on their own
Yes.
and see the signs and symptoms and warning
Mm-hmm.
that people with suicide ideas have,
Yes.
so that when you read what you have, sometimes you can read yourself.
Mm-hmm.
You read the signs and symptoms and you
You're
discover
you're
that
analyzing
what you
yourself.
are reading is what you have.
What you
Seek
think.
help when you
Mhm.
discover that.
Okay.
Let's go visit any nearest healthcare facility.
Mm-hmm.
Seek help from the psychologists. Seek help from the medics.
Mm-hmm.
Seek help from any person
Mm-hmm.
who has that knowledge of mental health.
Mm-hmm.
He will always help you. She will always guide you.
Mm-hmm.
And at the end of the day, we will all be at the same place in the terms of having well-being, socially, psychologically, and mentally.
Okay.
Thank you.
And thank you so much for those remarks.
Yes.
They're indeed touching.
Mm.
Now, because you've talked about mental health,
Yes.
now we find that we have different mental health issues.
Yes.
And unfortunately, these issues might lead to someone having suicidal thoughts.
Yeah.
So, from your medic perspective,
Yeah.
how important is early diagnosis and treatment of mental health conditions in preventions of suicide? How is it?
Yeah, thank you so much. Actually, early detection is the best thing to do.
Okay.
And that's why we are creating this awareness,
Mm-hmm.
so that people can come early in the facility
Mm-hmm.
and be able to seek help and
Okay.
actually eventually get this help.
Mm-hmm.
Now, the reason why early detection is important,
Mhm.
number one, it helps to prevent these suicide cases.
Mm-hmm.
When we discover that you have these suicide ideas, we will be able to take you through counseling,
Mm-hmm.
through psychotherapy, and eventually you'll come out of it. So it will reduce the rates
Mm-hmm.
of these suicide cases.
Yeah.
Number two, early detection also helps to give knowledge even to those who may not be aware.
Mhm.
For example, today you come with a person in the hospital, like a patient.
Yes.
You escort a patient to the hospital.
Mm-hmm.
You reach in the hospital, you seek the medical advice from the professional. Then the doctor or whoever is there, clinician or a nurse, will now give his or her views concerning your case.
Yeah.
Then you discover that your patient is having suicide
Mhm.
ideas, what will you do as a person who has come there? You will have to inquire what is the cause, why is she having it. And at the
Mhm.
end of the day, you yourself will be able to spread the message to other people who have the same idea,
Yes.
and eventually we will have that knowledge spreading and impacting more people.
Mhm.
So eventually the ultimate goal
Mhm.
is will prevent more deaths from suicide.
Absolutely. Absolutely. That is our aim. Yeah.
Yes.
To prevent and ensure that everyone is living healthy, long life, and
Yeah.
they don't have any suicidal thoughts.
Correct.
And when we are discussing now about wishing everyone to be healthy and well, what about now? What can family members, maybe someone, do if they suspect that there is a loved one or a friend who is maybe considering doing considering suicide? What should a loved one or a friend do in such a situation? And also, as you answer that, how can family members help people who have ever tried or attempted suicide and failed? How can they help?
All right.
Yes.
Thank you so much, Sheila.
Mhm.
Your questions are good, anyway.
Are they hard? Maybe
No,
they're
no,
hard.
they are good. No.
Okay.
They're actually timely, and because
Mhm.
it's for the benefit of our viewers.
Yes.
Because I'm sure some of them have the same thoughts.
Mhm.
But I think it is very important to
Mhm.
understand, as I said, that a family plays a crucial role
Mhm.
in this case scenario.
Okay.
A person who is having suicide
Mhm.
ideas can even get more help from the family
Mhm.
than any other place.
Okay.
This is the reason why.
Mhm.
If one of your sons or one of your daughters or one of your family member
Mhm.
has suicide ideas, and you as a person who is knowledgeable, who is aware, who knows what suicide is,
Mhm.
hears these things, the first step you have to do as a family member is actually to take this person to the hospital.
Yes.
So when you reach the hospital, you will get help
Mhm.
from the professionals.
Yes.
Number two, we also advise the family members not to have stigma or not to stigmatize these people,
Okay.
victims of suicide.
Yeah.
Because you realize that sometimes people take it for granted.
Mhm.
A person is telling you, I'm going to kill myself. Then you laugh at this person. Say you are joking. You are not serious. You act actually with casual manner,
Mhm.
thinking that this person is not
Is-
serious.
Yeah.
So
Actually.
how do you know that the person is serious? To me, I think if a person has spoken about it, take it seriously. Because by the time this person speaks,
Mhm.
he has had the time to think about it,
To analyze.
to analyze, to
Mhm.
internalize. He has had a meeting
Yeah.
to himself.
Mhm.
He has made up resolutions.
He has had
And-
the board meeting with
Correct.
himself.
And
Uh-huh.
sometimes he has gone through all those stages.
Mhm.
Stage 1 and 2. No, maybe the pending one is stage 3.
It's-
So
Uh-huh.
if he tells you that I'm going to kill myself, don't take it for granted.
Mhm.
Don't assume that it's just a usual drama.
Mhm.
Kindly sit down with this person.
Yes.
Hear this person properly.
Mhm.
Take your time and inquire more.
Mhm.
Actually, interrogate well.
Yes.
Deeper. Find out, why are you saying that?
Mhm.
Why do you tell me like that? You've never said it before.
Mhm.
Why today? They will always explain if you have time with them.
Mhm.
But the best thing also that you need to do, if you have no time to explain, to ask,
Yes.
or if you feel like they may not explain to you well,
Mhm.
take this person to the hospital.
Mhm.
And the hospital will interrogate more and
Yeah.
further.
Mhm.
And this person will get help.
Yes.
Remember, there are people who are introverts,
Mhm.
people who don't talk much, people who don't share their challenges.
Mhm.
They keep to themselves most of the challenges.
Mhm.
Remember, people who commit suicide, mostly,
Mhm.
they rarely share information.
Yes.
And I want to tell them today that when you share your challenge,
Mhm.
you have solved it. So a problem shared is a half solved. If you share your challenge that you're going through,
Mhm.
if you feel like you are giving up,
Mhm.
kindly don't just keep it to yourself. Always share. Share with the people who are close to you. If you feel like those who are close to you are the cause, just have time, go to the hospital. The professionals in the hospital will listen to you, and they'll always help. So a family should play a crucial role by helping this person to go to the hospital and get the help.
Mhm.
Number two, A family should stop stigmatizing these people, should stop taking people casually, should stop, especially these close family members, should stop even spreading the message to others about their family members who have attempted or tried to commit suicide.
Yeah.
Always keep it secret to yourself. Take this person to the relevant people, the medics, who will always intervene and save the situation.
Absolutely.
The other thing the family should do is that they also should also create safe space for healing. By this I mean, even if the person has attempted suicide, don't spread the message to every visitor that comes at home. I know some family members will always want to share the story to everyone. It is not advisable at all
Absolutely.
to share this information with others. Create safe space to this person to heal. Even after visiting the medics or the hostel, let them have that safe space to heal. By creating that space, it means you do not share information to others, neither do you provoke them by asking frequent questions. Give them time to heal. And number 3, always try as much as you can to provide whatever need they need from you. Even if it is food, even if it is clothing, if you can provide, kindly provide to them. Don't provoke them. Don't question much, but have much time to embrace them.
Absolutely. Oh my, that has been indeed a handful, but a very important session and a very important statement that each and every one of us should really look into. I'd like maybe for you to give a closing remarks, like maybe what message we'd like to give to our viewers back there at home, and or share with the public in regards to this wonderful and amazing month of Suicide Awareness and Prevention Month.
Thank you so much, Sheila.
Yes.
Our dear loved listeners, what I want to request you today is that in life, challenges are temporary. There is no permanent challenge that you will face that will warrant you to take your life. There is no any challenge in life that is having equal measure with your life. The life you have today is so precious that Christ had to pay for you to be alive today. So there is nothing in this life that should push you to take it away. So always share the challenge you have. Whatever you go through, don't keep it to yourself. There are many people who are facing it, but they are not taking their lives. They are seeking help. Also be among those ones who will seek help. And always remember that whatever you go through, God is watching over you. Just have it known to God. Take your request to God. And after doing it, visit a facility, a hospital that will help you. If you don't get any help from any other hospital, visit our hospital, to One Highway Mission Hospital, just within Kitale here. It will help you. We will give you people who will take you through the challenge and will help to come out of it. They will provide a solution. But don't kill yourself. Don't even think of dying. Let God himself, who planned for you everything, have that authority to call you at the right time. The other thing is that this month of September is a very important month. We as AfriaCare Foundation, we are having an event coming which will announce the dates. This date will actually come towards the end of this month. And we'll have this opportunity to share the same knowledge we have shared here. And we welcome you. When it comes that time, we'll announce to you, kindly come and let us learn more about suicide. Because if we don't do it today, we are losing a lot of people, especially youths. Remember, this suicide affects mostly people who are below 50 years of age. And we have said that it is more frequent with ages of 15 to 29 years. These are the future leaders of this country. If we lose them today, then we have no future. So kindly, you as a parent, you as a youth who is listening today, kindly take a step. When you have these features we have discussed, please visit our facilities, visit our hospital, visit our foundation offices. We will give you the location and the numbers, and kindly, you come, we will help you where we can. But one thing I have to leave it with you, that you have no authority to kill yourself.
Mm-hmm.
It's only God who can take away our lives.
Amen. Thank you so much, Daktari. It has been a very interesting segment, and I hope we've been able to create awareness on these very, very crucial matters. On matters dealing with suicide, it is very crucial. But as we have said, ensure that you are able to identify these warning signs, and also that you have no right to take your life. So please ensure that you continue with creating awareness about this wonderful month, and also check up on each other, check up on that friend, on that family member that you haven't spoken with for a long time. Just say hi, ask them how they're doing, and all will be well.